Hi, I had an upper bleph with Dr. Nemeth. The reason why I had the upper bleph was because ever since I was a kid, I had very heavy upper eyelids, and it had always bothered me. As an adult, I spent hundreds, probably more, on different creams, different treatments, trying to reduce the upper eye area. Finally, I went to an esthetician who told me that the only way to really resolve the issue was with something called an upper bleph. The idea terrified me. Thankfully, though, I found Dr. Nemeth after a lot of research, and from the moment that I met her, I felt comfortable with the idea of the process. She exuded competence, confidence, in exactly the right proportions that one wants from a surgeon. And I agreed to go ahead with it, and to do so with the local anesthesia. And after some initial trepidation, came in, did it, and the most painful part of my process was trying to remove my wedding ring prior to the procedure. So that would be my tip. Remove your jewelry, especially stuff that's hard to remove, prior to the day of the procedure. But Dr. Nemeth and her staff were absolutely wonderful. I am so grateful to Dr. Nemeth. I love the change that resulted from the procedure. My eyes feel more open, and I think look more open, and I'm very happy with it. I'd recommend it to anyone who's interested.
In this case, I did an upper blepharoplasty on a healthy woman in her 40s. She was bothered by some of the loose skin of her upper eyelids, as well as kind of lack of definition in the crease area. In this surgery, I addressed the loose skin by essentially removing it, as well as a small strip of her orbicularis oculi muscle to help deepen and create a better crease. And in addition, there was a bit of herniated septal fat that we addressed during a blepharoplasty. And in her case, it was in that very central middle fat pad. So that was all done during the surgery, closed with a nice buried suture that will be removed at about 7-8 days post-operative. And I expect her to do very well with minimal bruising and a pretty short recovery time.